Hi, and welcome to AAHPO's American Armenian Health Professional Organization's TV Health Program. Today's topic is prevention of cervical cancer and human papillomavirus, which is HPV virus. Recently, there are controversies of screening of Pap Smear and screening for human papillomavirus. So we have invited Dr. Lena Merjanian, who is board certified in obstetric and gynecology, and she's a faculty, Robert Wood Johnson Medical School. At the same time, now it's called Rutgers Medical School. Dr. Merjanian, welcome to our program.
Thank you.
Let's talk about the Pap Smear and human papillomavirus. What time we should do Pap Smear and why human papillomavirus is that important.
Right. So up until a couple of years ago, women always used to go to their gynecologist for a Pap Smear every single year. Recently, the guidelines have changed, and so we're able to actually space out how frequently women need to get Pap Smears.
Right. The teenagers are not anymore required to have Pap Smear.
No. We currently start our Pap Smear recommendation for screening starting at the age of 21.
21. Even though human papillomavirus, which is HPV virus, is so common among teenagers, why the recommendation changed?
So human papillomavirus is a very common infection. It's actually a sexually transmitted infection that many people get infected with. We worry about human papillomavirus when the virus actually stays in the body for many, many years.
Okay, so in the beginning then, if somebody acquires papillomavirus, it does not mean they're going to get cancer right away.
Right. In a healthy young woman who acquires human papillomavirus, they tend to clear the infection so that they don't get cancer. But if the human papillomavirus, especially the certain type of it, stays in her body for many, many years, then she becomes at risk for cervical cancer.
So then it's really then guidance is okay, guidelines is okay now, new guidelines saying that 21, we should
Correct.
start with Pap Smear.
Right.
21 on. Okay, so we start Pap Smear 21 on. How about somebody that had Pap Smear consecutively several times and they're normal, now they're 30 years old?
So we start the Pap Smear screening, like we had mentioned, at the age of 21,
Right.
and then we do them every 3 years up until the age of 29. When a woman that turns 30 years old, we then do HPV co-testing with the Pap Smear. The co-test is the high-risk type of HPV, the ones that we know are associated with cervical cancer. So we do the Pap with the co-test, and that allows us to space out the Pap Smears every 5 years until the age of 65.
Okay, so they are 30 years old, they're having the co-testing. Let's say co-testing is suspicious. What would you do?
So it depends on what level of suspicious the test comes back. Oftentimes the next step in the management is to do a colposcopy, which is a big microscope that we take and look at the cervix and take biopsies if we think they're necessary. Yes, this is a very quick office procedure.
So the colposcopy shows which sections that we should biopsy.
Correct.
And suspicious.
Correct.
If it comes back positive, what is the treatment then?
Again, there's many different levels of positive, and if it becomes at a level where we think she needs a next step procedure, that's usually what we call a LEAP or cone procedure. That procedure, we go to the operating room and we take a little bit of a larger portion of the cervix for diagnosis and treatment.
It means that when we do the cone biopsy or the treatment at the same time, the margins has to be clean in the biopsy, then we'll say, okay, they are free of the disease.
So yes, the goal is for the margins of the biopsy to be free.
Right.
Sometimes if the margins are still positive, then we continue to follow the patient at specific intervals with Pap Smears and colposcopies.
Right. Is there any problem doing colposcopy and future pregnancies?
Colposcopy by itself is no risk for future pregnancies. Sometimes what we worry about is if we have to do the further test, the LEAP or the cone test.
Okay.
Because that takes actually a larger piece of the cervix off, and sometimes that puts women at increased risk for what we call an incompetent cervix.
Right, they can have abortion, kind of.
A miscarriage, more of a miscarriage, right.
So let's take another patient, 22-year-old, comes for first time for Pap Smear, and do we do virus screening for that person first time when they come for Pap Smear?
So we don't do the specific virus test, we just do the cytology Pap Smear.
Right. So what's the difference between that? Let's explain to our audiences.
So the Pap Smear itself just looks at the cells on the cervix.
Right.
The specific HPV test actually looks at the DNA if the HPV virus is present.
Right.
And we don't routinely do that under the age of 30. unless there's a specific abnormality on the Pap smear. Every age range, there's actually different recommendations. In the very young woman, between 21 and 24, we're actually a little more conservative with how we treat. Because what we don't want to do is we don't want to do excessive procedures and biopsies. So we tend to watch their Pap smears and watch colposcopies.
Is there any recurrence of this virus?
You know, it's interesting because HPV is a virus that sometimes continues to stay what we call dormant in the body, meaning it just sleeps in the body. And every once in a while, if your immune system is a little compromised, you're stressed out sometimes, the HPV virus can actually come back.
So then really reoccurrence could be there. So the virus is in the body, but not necessarily active.
Right.
So that's why every 3 years they have to be screened.
Correct.
In the screening process. But over 30, then you said every 5 years they will go?
With the HPV test. If the HPV co-test is done after the age of 30, it's every 5 years.
So Dr. Merjanian, when do we stop screening for Pap smear? What age?
So the current recommendation is at the age of 65 in a healthy woman who's otherwise had normal Pap smears up until her current age.
Right. How many consecutive has to be negative in order to say we shouldn't have any more?
Well, we at least recommend 3 consecutive normals in the recent time period.
Now,
correct.
Let's take a postmenopausal woman.
Yes.
Then has history, or not history, but chance of developing endometrial cancer.
Correct.
So what is the recommendation in terms of Pap smear or what signs and symptoms they should look?
So the HPV and the Pap smear is more for the cervical cancer, and the cervix is the opening to the uterus. When we talk about endometrial cancer, especially in a woman who's after menopause, we're talking more about the cells on the inside of the uterus, in the lining of the uterus. Typically, the way a woman would present after menopause, if we were suspecting endometrial cancer, is with bleeding vaginally.
So we would call it postmenopausal bleeding.
Correct.
They finished their periods, now 2 years passed, they have some spotting or bleeding.
Correct.
That's suspicious, we have to screen for that.
Correct.
And what's the process for that?
So usually we start with a pelvic ultrasound where we actually can take a look at the uterus, take a look at the lining on the inside of the uterus and the thickness. It should be very thin in a postmenopausal woman. If we find that the inside is thick, then we usually recommend a biopsy in the office.
Is there any number like 0.5 centimeter or 5
there
millimeter?
Is. Usually we do say less than 5 millimeters is normal.
Right.
Above that is not.
Right. So that's why if they go to their gynecologist, if the gynecologist call says you have thickened inlining of the uterus is more than 0.5 centimeter, that means that there's a possibility, chance of having cancer. That should be checked.
Yes, there's a possibility that there are abnormal cells. There's a possibility that it actually may be a polyp, which is benign.
Right.
Or the worst case scenario that we think about is the cancer of the lining of the uterus.
So they come to the office now. They have 1 centimeter, which is thickened uterus inlining. What is the process now?
So we do a procedure in the office. It's called an endometrial biopsy. It's a fairly small procedure.
This is in-office procedure?
In the office. We don't require anesthesia. It's a little bit of a crampy procedure. And what we do is we place a little straw inside the uterus and take a tiny sample of the lining of the uterus, and then we send that sample to the pathologist, which is the special doctor that reads the cells. Usually we have a result back in about a week, and then we can let the patient know if we think that there is an abnormality that we have to be concerned about.
Right. If the pathology report comes back says that the person has endometrial cancer, what is the next step?
So usually if that were the case, then we would refer the patient to a specialist, specifically for gynecologic cancers of women, who are gynecologic oncologists.
And they do the surgery?
Yes.
Right? Most of the surgeries involves the uterus and taking the ovaries out.
Correct.
Right?
Correct.
And altogether, so we call total abdominal
hysterectomy.
Bilateral ovaries is a long name
Correct.
for that, but means that taking the uterus out, taking
and
both
the ovaries out. Yes.
Do they need any chemotherapy or any treatment afterwards?
It depends.
Okay. So is there any screening? If we diagnose endometrial cancer, is there any further screening necessary for the staging of the disease?
Usually the staging is done surgically at the time of the procedure for the hysterectomy.
Dr. Merjanian, thank you very much for enlightening information. Hopefully we'll see you in another program.
Thank you for having me.
Now it's time for this week's article. It is vitamin D deficiency and Alzheimer's disease. Vitamin D is vital for optimal function of many physiological systems in the body, including for our immune system, bone health, nerve growth, and nerve function. Therefore, vitamin D deficiency may increase the risk for dementia and Alzheimer's disease. Recently, a study from United Kingdom investigated low blood levels of vitamin D and its association with all causes of dementia and Alzheimer's disease. 1,600 older adults free of dementia had serum vitamin D measurements and were followed for 6 years. In this study, they found strong association between low vitamin D level and risk of dementia and Alzheimer's disease. Those who had low levels, less than 25, had 122% increased risk of dementia. Besides dementia and Alzheimer's disease, vitamin D deficiency increases the risk of heart disease, diabetes, osteoporosis, hip fracture, cancer, inflammation, fecal incontinence, and increases the risk of overall mortality. Get your vitamin D level checked in the blood test and take vitamin D3 supplement if the level is less than 29. Optimal level is 50 and above. Good health is precious and priceless. Stay informed. Don't forget to visit AAHPO's website for more up-to-date medical information, aahpo.org. I'm Dr. Orhan Karatoprak. Until next program, so long.